Welcome to the Ask Dr. Boris podcast, the health and wellness podcast with Dr. Boris Del Cid and co-host Crizza Booth.
This is Dr. Boris Del Cid. Welcome back to our podcast, Ask Dr. Boris. Remember, I'm a doctor of chiropractic, but I'm not your doctor. So anything and everything you hear from me, make sure you talk to your doctor. We are happy to come back and start again our podcast. We're going to get the latest topics of discussion and give you the best information available. So let's talk a little bit about my background. I am a licensed doctor of chiropractic, been practicing since 1990. I went to Los Angeles College of Chiropractic, which is a division of the Southern California University of Health Sciences. I also have a degree in human biology with an emphasis in anatomy. In part of being a doctor of chiropractic, I had been asked to do certain things and no political association. So I was selected as the healthcare delegate to the National Council of Disabilities in the celebration of the 20th anniversary of the Disabilities Act, Americans with Disabilities Act. And I attended the White House as a result of that. So I've addressed a few of the departments there. I addressed the Department of Transportation, also relayed information to the National Health Institute in the United States. Also was invited lecturer at the government of Panama, Central America, where I'm from, and I addressed the National Institute of Health there regarding some issues that they were discussing on healthcare and the integration of health network providers. As a result of that, my experience in this field, it's been well-rounded, where I have been, traveling about discussing issues of healthcare, as a matter of fact, and also practicing sports chiropractic or sports medicine, as it's known. I've been a team doctor for a semi-professional football team here in Santa Ana, the Brea Velos. That's back in the days. There are certain things that I forget now. It's been 35 years that I've been in practice. I graduated in 1989, started working in 1990. So I've been in practice ever since, and I enjoy it. It's my life. It's what I completely and absolutely love to do. And I'm one of those individuals who live his profession. So I like keeping up with what the trends are and discerning what's good, what's not good, what to pay attention to, and what is new and advantageous to all our patients, and applying what is tried and true also. I'm here with our producer-director, Mr. Thomas Roberts, and we picked a location that is absolutely fantastic. I love to call it podcast al fresco because we're outside. And if you hear some natural sounds of birds and the wind and things like that, it's because we are outside in Laguna Niguel. Well, actually, this is Aliso Viejo. And we're completely outdoors, enjoying the freshness of the day, the beautiful sunshine, and the crisp temperature and the air that is around us. We're refitting our podcast. We're revamping, and Criza will be back soon in a few editions, quite possibly the next one. But we're regrouping. We have new format, and we're getting all the information that we want to give out in a new way. So we're going to go back to the dialogue where there is exchange of questions and responses and ideas and opinions. And we can't wait to get this back to you for your learning experience. Today we're going to address user-generated questions, and we're going to give you answers based on my clinical experience and 35 years of practice. Let's get started with these questions, and we're looking forward to answering your questions too. So here's our first user-generated question. It says, Dr. Boris, I sit at my desk for 10 hours a day. My neck is killing me. What's the solution besides just stretching? So First of all, I want to recommend that anytime there's consistent pain that goes over a certain amount of time without changing, I would say go seek advice, professional advice. Go see your chiropractor. In there, we can have, a series of studies, x-ray studies, orthopedic testing, neurological testing, and make sure that the condition, it's treated the way it's supposed to. Now, if once you've done that, then your chiropractor or whoever your medical provider is may recommend certain things. In my clinical experience, as I said, 35 years, I do recommend a few things. Function and structure go together. So taking a set of x-rays will allow us to see what the structure is in your neck, because your neck is supposed to have a forward curvature. It's called a cervical lordosis. What that means is that your neck is supposed to be going forward like a backwards C, letter C. That actually allows your head to translate that weight through your spinal column without having to put too much pressure on it. The muscles that surround them give them stability. So if there is a distortion or a change in the structure there as to how your neck is aligned, whether you have a straightened neck, which we call military neck, and that's not a good thing. Keeping your head and neck straight like that is not really good, because it alters that natural curvature. What we want to do is we want to make sure that the structure is completely within the parameters of normal, of normalcy. That way you can have that weight distribution of your head over your shoulders by distributing that weight, equitably. So the muscles that are around that neck are supposed to help you move your head either backwards, forwards, sideways, or rotation, turning it to the sides. So all these muscles, if there is a change in your structure, you may have tension on those muscles. Over an extended period of time, those muscles will become tired. And then if that continues to go, they become weak. So then you start having not only aches and pains from the muscles being weak and tired, but then they cannot hold the structure, which is the neck, the vertebrae in the neck, and then they can cause other problems, which include, but not necessarily limited to, impingement of the nerves that come out of the neck, and also starting adaptive processes of degeneration, meaning arthritis. So what we want to do is we want to have both. We want to have you stretch those muscles. For instance, I have a patient that is a computer genius. And he dedicates his life to it. So he spends extremely long hours behind the computer in his desk. And he has the tendency to say, "Hey, doc, at the end of the day, my neck is so bad I can hardly stand it." So what we did is exactly how I started the segment. We diagnosed what the condition was, the structure was altered, and as a result of that, many other structures around it, including the nerves, were being affected. So we realigned those vertebrae by manual adjustment. But then that structure is used to being out of its alignment. So what we want to do is we want to stabilize it. We want to make sure that those muscles that keep that area stable are nice and strong. But see, there's two types of strength. Strength that gives you power strength, as opposed to endurance strength. So if you are in a desk or on your desk and working on your computer, you want to make sure that those muscles that are stabilizing your head and neck are able to do this for an extended period of time. So basically, the strengthening exercises that you need to do require that you do them consistently and on a regular basis as far as how many sets and repetitions you do. So, rounding it up, you want to get it diagnosed, you want to get this structure realigned if it's needed, and you want to have neck stretches and strengthening exercises so your neck safely can do what it's doing on a daily basis, which is the type of work you do. Okay, so we got another question that is really popular, and I see a lot of patients that have this type of problem. So, one of our patients asked, how do I protect my back during my daily commute? I'm stuck in traffic for 2 hours. Again, I want to reiterate that we want to make sure that something like this that bothers you that often, you get it looked at, okay? So similarly, we want to make sure that x-ray studies are done, orthopedic examination, neurological examination, and all those things, so which we do in our office. Ranges of motion are also included, and I mentioned that on the segment with the neck problems. Ranges of motion in the lumbar spine or low back are also necessary in order to assess what kind of restrictions, if there are any, and also through the x-ray studies to see the curvature of your low back, which is actually similar to the one in your neck. It's called a lordosis, and it's a forward curvature that looks like a backwards letter C. And that's also used in order to distribute weight equitably anterior or posteriorly, meaning the front part of your body and the back part of your body. So, again, we're having a situation where you are sitting down for 2 hours. Endurance, again, we want to make sure that the muscles that stabilize your spinal column in the lumbar region are strong enough and have the endurance to sustain that position for extended periods of time. So, for instance, there are two very powerful muscles in your low back. They're called the iliopsoas muscles. And these guys are attached to the lower segments of your back, to the vertebrae. So these guys are the ones that make you bend forward or go back from the stoop position to the seat or erect position, and then sideways, and help you also rotate. When these guys are asked to be working on an extended basis without having the proper exercise or basically training to do that, they're going to get weak. And if that's the case, then the structure is not going to follow what the function is. The function of that vertebrae or those vertebrae is to maintain alignment and also free of any interference with the nerves that exit the spine to the sides. So remember, every one of the muscles of your body require a nerve to give them a signal in order for them to do their work. And happens to be that they come out of your spinal column all the way from your neck down to your low back. So stretching exercises are good, but also we want to do strengthening exercises, specifically of the core. Core exercises are all over the internet. You can see them. However, I say consult with your healthcare provider, your chiropractor, your PT, whoever it is that you're seeing, and they can give you the exercise or recommend the exercises that are appropriate for your condition, should you have a condition there that needs to be monitored. That way you have both the right exercises, the type of exercises that you need, and also prepare before and after your day of commute. Okay, so another question that was asked is like, Doc, how do you assess my conditions and such? So when we take a consultation we take a full history of the patient. We ask about the activities of daily living, including their exercise or lack thereof, the type of work that they do, and all things that are included in their lifestyle. So then we do an evaluation. Physical evaluation will include a palpation for the muscles to see if there's muscle spasm, muscle tension, muscle weakness, by making them do a range of motion test after the palpation. We do the range of motion test in all angles, forwards, backwards, sideways, and rotation. That way we can see where there is a lack of range of motion, or even hyper mobility too. That's assessed by that, and also by palpation by hand. Then we use orthopedic testings. The orthopedic testings are done at the office, where we challenge certain muscles by doing active tests. Like, for instance, I will have your leg, raise this leg all the way out here, and then I pull it down and or push it this other way. We activate muscles, and sometimes we ask those muscles to be inactive, and then we lift them and ask them questions to to do or not do. So the patient will go through an orthopedic evaluation through testing. Now, depending on what symptoms they have, they say, "Hey doc, I have a burning sensation sometimes," or pins and needles. Those are neurological evaluations that need to be done, and usually those are coming from the sensory portion of your spine, your spinal nerves that exit the spine, actually. And then we can do certain things to determine what areas it's coming from and all that. So a thorough assessment of your condition is done through x-ray examination if it's needed, palpatory, range of motion, orthopedic, and neurological evaluation, all done at the time of consult. On top of a thorough history of if there's been an injury, is this a chronic condition, is this an acute condition, and then from there we make the recommendations as to what it is that you need. Prior to that, obviously, we reach a diagnosis. We have a differential diagnosis and a working diagnosis, and then we propose a treatment plan, which may include exercises for strength, also stretching, and to maintain what we achieve after the period of treatment is accomplished. Okay, next question. Hey doc, I do hot yoga but I still have lower back pain. What am I doing wrong? Okay, this is somebody that just sent us a question. Obviously, yoga alone is not going to cure for that, to use that word, your low back problems. First, again, in every case, it's the same thing. Consult with somebody to find out what is the source of your condition. Why is your low back giving you pain? From there, we can assess then if yoga for you is the indicated type of exercise. I particularly think yoga is fine. Now, there are different types of yoga, and you have to be careful because, for instance, and I'm not saying that hot yoga is bad. I'm saying there's some people that may not be ready for hot yoga for other conditions such as intolerance to heat, propensity towards heat exhaustion or heat stroke, people with high blood pressure, and things of this nature that are not good for you if you're doing a yoga that not only requires exertion, physical exertion, but it's also going to expose you to a high temperature. So the adaptation of that high temperature may cause some problems. Also, women and pregnancy, heat is contraindicated, so you don't want to be doing hot yoga. But at the same time, yoga is a good thing and is also could be not a good thing for you. For instance, yoga does stretching of the muscles, but it also gives you the ability to strengthen them. And holding postures or positions are good for that. However, there are certain positions or poses, as they call it in yoga, that may not be indicated for someone, let's say, with a disc herniation, because they can aggravate it. Also, what type of stretches you're doing. Some of them, like the cobra, for some people it is indicated. For some other people who have problems with their low back, it's not indicated. Downward dogs may be indicated for some and not for others. So again, the reason you may not be getting the best results from your yoga is because perhaps the condition that you may have has not been diagnosed and addressed accordingly. With respect to yoga, there are times where you say to I say to my patients, okay, try the yoga, and they come back and they give me a feedback and they say, hey doc, you know what? I've noticed that the yoga is actually making it feel a little bit worse. And then I ask, okay, what are you doing? And then they explain the poses and all this. So, for instance, I would say, okay, since you're in acute pain now after your yoga sessions, stop doing it for a while. Let's get you doing other exercises that will strengthen and give you endurance in the low back, and then slowly reintroduce your yoga. Staying away from certain poses that you know and have been identified, but where you told me you notice that it gives you more pain. So yes, there's times where I say stop it for a while. Sometimes it's stop it completely because that pose is not going to help you. That may not be saying that you have to stop yoga completely, but stop doing those positions and then do the ones that are more beneficial to you. So according to what's your response to your yoga poses and routines, we can modify them. We don't want you to completely stop it if it's not necessary. Hey, so listen, please don't fill my email with, hey doc, don't bag on my yoga. You can try any yoga you want, I'm telling you, but before you do it, consult with your healthcare provider. Like I said, there's all kinds of different types of yoga, and some of them may not be appropriate for you, for the condition that you may have, or for the benefit of your condition too. So, not telling you not to do your yoga, just got to be the right type. Okay, so yeah, here's a theme that it's been going on and I guess growing, and in no certain terms it will continue to, is what we call tech neck. So our producer here is hard at work with his head forward, neck forward, working on all the apparatus that he needs to work with and make us sound good. And can you imagine? He's doing this now, and then he'll go edit and put the final product and all those things that he does. People that are working on a desk are exposed to this. People who have a cell phone are exposed to this. Your kids are exposed to this. So tech neck should not be only associated with people in technical industries. It's associated with anyone that has some type of smart gadget in their hands. Computer, your phone, your TV, any and all. At the very beginning, if you were to be working on your computer in a correctly assessed desk, let's say ergonomically correct desk, the first 5 minutes you might be in that right position, but then naturally your head starts migrating forward towards the screen. What that happens is disrupts that line of weight bearing that we have in our neck. Like I was saying, the structure and function go together. You're stressing your neck because now your head has a definite weight, anywhere between 12 and 16 pounds, depending on the individual's size. Now you're making that neck hold your 14, 16 pound bowling ball weight head in a position where it's not designed to do for an extended period of time. So the tech neck basically develops after a transition, a period of time where you are putting your neck at risk by having your head move forward. So technology has given us that as a result of extended periods of time in a position where we're not designed to be, and it's not done because you're not trying. It's just subconsciously you do it. Your head migrates forward, your shoulders move forward too. You end up having muscles that are overstretched, and as a result of that, getting weakness, and the alignment of your neck actually suffers. Then that can start a problem because then it becomes painful, irritated. You can start having arthritic changes as a result of that, and nerve impingement. Here's another thing that I would suggest is detach yourself from that technology. Tech neck is not necessary 24/7. I know some people that if they could be on their phone, looking at their emails, doing TikTok or whatever, during their sleep if they could. So do something for yourself. When you are taking a break, don't take your phone with you. Don't do extra computer work. Give yourself time for a relaxation period where not only your neck, your head, your shoulders, and your eyes. Your eyes are actually very much exposed to the glare of the computer or your screen, and also the focus, the visual acuity of your eyes, depending on what kind of device you're utilizing, will suffer. We know that is a fact. So give your eyes a break. We use the 20-20-20 rule. After 20 minutes of computer or phone or tablet work, take 20 seconds off, look away for 20 feet, and look at those 20 feet for 20 seconds. Then you can come back to whatever it is that you're doing. But besides that, when you're taking a break, leave it alone. Give yourself a break. Okay, another question I've been asked here on the tech neck: is my smartphone literally breaking my neck? So we addressed that already. Yes. Say you worked at your office with your computer the whole day. Almost everyone nowadays, unless you're doing some outside work, manual labor, construction or deliveries or whatever, you're not using a computer. But then you go back home, and you use your computer. But also, we all have phones. And when you have that phone, you get on it, the same thing. Look at somebody else that is using a phone besides yourself, and look at their head and necks. Look what is happening. Their heads and their necks are moving forward just to look at that screen, and they fixate their eyes to it. So your telephone is actually contributing to your neck, developing that tech neck. So yes, your smartphone literally is breaking your neck. Not that it's, breaking the bones, but it's breaking it down. The function and the structure go together, and if we do this for hours on end, you can check in your phone and see the activities, how much time you spend per day, per week, per month on that phone. So it's literally not helping your neck. All right, so look, I have practiced here in Orange County for my entire time as a chiropractor for 35 years. And I tell you what, I have had my share of surfers. And surfers come in with a variety of problems, including but not limited to low back problems. Can I surf, Doc, with lower back pain? Yes, you can, and endure the pain and then make things worse, or have it properly diagnosed, determine what the condition is, and then we clinically mold a treatment program that restructures the area, does the adjustment that need to be done, and then provide you with the exercises that you should have in order to maintain that strength and stability. Stability is basically provided by the muscles that surround the spine, and they have to be able to do this for an extended period of time. That's the endurance part. So most people believe that, I'm doing exercise while surfing. Yes, but the position of surfing is you're on your belly on the surfboard and you're paddling. Now, right now we're addressing lower back pain. Surfers also suffer from upper back pain, thoracic pain between the shoulder blades, and we can also address that later. And the neck, because when you're looking towards the beach, your head and neck are in a extended position. So that's also another condition that we treat for surfers. But lower back pain for surfers come from almost, imagine yourself like being in a cobra position when you're going to push up. Those muscles in there in the low back are actually contracting really hard in order to bring your torso up. So what we want to do is strengthen those muscles, so you can do that when you're getting off the board. The other thing is, when you are on the board, what do? You kind of squat and bend forward. Remember, if you have a disc problem or nerves impingement, certain positions can and will irritate that low back because you are bending forward, squatting, and turning, twisting. our low backs were not designed to turn that much. I mean, the L4, L5, L5S1 segment, twisting is not good. That's why golf also has a problem. Golf players have a problem with low back problems. But going back to surfing, you can surf, but you need to address the problem, because otherwise it's going to get even worse. So look for the care, find out why you're having that low back pain, and correct it. Therefore, you can enjoy your surfing. We're talking about this surfing, bending forward. There are certain things that people have in common with low back pain, activities of daily living that affect it. Among them, I tell patients, look, watch out when you're vacuuming, because when you're vacuuming like that, you're bending forward slightly and also rotating and also laterally flexing. You're putting pressure in areas that may be putting a stress on the nerves, putting direct pressure onto the nerves in the spine that exit the spine and give you back pain. And bending over the sink, slightly bending over the sink to do dishes, or on the washing machine, or if you're working on your car. Similar things that you experience on all your activities of daily living that includes forward bending, and it doesn't have to be completely bent down. The first 5 to 10 degrees of trunk flexion renders your low back completely vulnerable, especially when there is muscle weakness and there's no ability to maintain that posture there because your muscles are so tight and weak. So the vacuuming position is one of those that I get complaints all the time. Hey doc, when I'm vacuuming, moving forward like that and lateral, bringing the arm out and twisting and turning, that bothers me. What is it? Should I not vacuum? Of course you should vacuum, but let's get those muscles and structure in the low back stronger for you to be able to do this. I get lots of questions about wellness, exercise, and all these things. In Southern California, we have one of the best health habits in the world. People here are fit and all that, and they're always looking for trends. They want to see, hey doc, what do you think about this? What do you think about cryotherapy? What do you think about if I have pain, do I do CBDs? Well, I just talked to somebody and said, hey, yeah, the CBD, it's fantastic. It's helping me. We'll touch up on that. Also, cryotherapy, we'll put you on that machine and it's really cold and it's really good. It's exhilarating and at the same time it makes me feel really good. And I get to see a lot of treatments and trends around this area in Southern California that profess, cure and maintenance of wellness and all this stuff. So I mentioned CBD. Okay, now, then again, there are regulations on CBDs and there are no regulations on CBDs. And again, consult your physician or your healthcare provider. I am not endorsing nor condemning the use of CBDs. I'm just going to give you a little bit of my knowledge on it. So with the CBDs, you get the result of cannabis without the tetrahydrocannabinol, THC, which is the psychoactive ingredient of marijuana. They have to be completely, well, not necessarily completely, but there is a small percentage allowable by the law here in the state of California. That aspect of it gets taken out, so you're not, with the psychoactive result of marijuana. So the CBD oil basically is a powerful anti-inflammatory. And it also affects certain receptors, pain receptors in your nervous system, a sensory nervous system that eliminates a sensation of pain. Now, not feeling pain is one thing that, it could be good and not good, because if you're feeling pain, that's an alarm system. If you're not feeling pain, then you think you're okay, and then you may disregard some of the things that could irritate that pain and or aggravate it. So aggravated is making it worse. We injure on top of an injury, or exacerbation is bringing it back. So CBD is a subject that is brought to me quite a bit. And I said there are good properties of it. It's highly not regulated, but it requires certain amount of scrutiny, in my opinion, to make it effective. Then people ask like, hey doc, have you seen those cryotherapy places where they put you in a machine and you're like 10 minutes in there, whatever it is, 2 minutes, 5 minutes? I've never done it. But cryotherapy is another fancy word for ice therapy, cold therapy. Cold therapies are good for anti-inflammatory effects. Exposing the body or the area of the body, or an area of the body, to cold is good because it decreases inflammation. And if it's done right outside or after an activity that causes that, it can prevent pain, inflammation from the result of this that could take days to get rid of. That's why football players and other, players or athletes that are doing their sports go in a cold tub full of ice to prevent the extended period of recovery that inflammation may cause from their sport. So cryotherapy, is it for everyone? You got to consult again to your healthcare provider. There are certain people that cannot, should not do this type of therapy. So make sure that you get the clear for that, and then ask about, when you go to these places, how is it going to be done? How long does it last? What are the potential side effects of it that may not be good for you? Obviously, sometimes, not sometimes, but a lot of times they tell you, oh no, everything is good, and they're not doctors, so they don't have the training to ask you the right questions. So consult with your doctor. Now, trendy wellness treatments in Southern California, and I say Southern California because that's where I live. So there's all kinds of different things that light therapy, cryotherapy, do yoga, do CBDs, and all this. The word here, trend, means that what's hot at the time. No pun intended. So the ones that are actually tried and true are the ones that you want to stick by. Not everyone can do all these things. I mean, like I said, the cryotherapy or the hot yoga, there are limitations to individuals. So we want to make sure that these trends that you are considering as a treatment or wellness type of treatments, you consult with somebody that you see as a professional, healthcare professional. Be wary, ask questions, disclose the type of conditions that you have or things that you're under treatment. So contraindications can be assessed and then said, yes, you should do this, yes, you should try that, or not. Giving stuff a try or trend treatments a try is not a bad thing. But you got to consult with somebody who knows what to avoid. And these things may have a repercussion that you may not like or want. Okay, so on our work life, what we call the lifestyle integration, since that virus came along, a lot of people ended up working from home. And that means that you do not have some of the advantages of being in an office, which means possibly ergonomically designed workstations where your computer is right in the right position and your chair is really good for you and all this. By the way, nothing ergonomically correct is the cure-all end-all, because your body does adaptation processes that, like I was saying, if you're staring at the screen of your computer after a certain amount of time, unbeknownst to you, your head and shoulders and neck start moving forward towards the computer. You can be looking down or up for an extended period of time. That puts stress on these structures, the neck and the muscles and your shoulders and all these structures that are used on these activities. So having to work from home can be a blessing and can also be a little bit of a curse. Not having the ergonomic design office may be a little bit of a problem. The blessing for you is that you could have, and I recommend this very often, depending also on the condition of the patient, a stand-up desk. Now there are fancy ones that you can get online, and there are other ones that you can make at home. So there are things that you can do, like you can have a fancy stand-up desk from your desk or your table, wherever you're working from. But if you don't want to go that route, because it can be a little expensive, $200-300, you can make your own. You can have low-tech stand-up desk. Go to one of these stores where you can purchase lumber, buy a piece of wood that is long enough that it can put your laptop on there, and then you stand. You can stand up and put it at the right height, with your elbows and your shoulders are, in the right position, like 90 degrees, your elbows with your shoulders, and your screen can be higher up at the height of your eyes. So you can stand up and avoid the worst position for your body, for your low back, is sitting down. So you can avoid that by standing up. So now you have the ability to sit down and to stand up. If you want to sit down for a little bit, don't do more than an hour at a time. That's what I recommend. Sometimes people get lost on their computer work, and there's hours before they get up. Some of them, are even going to the bathroom because they're so into their work. But then you can make a routine: stand up, sit up. Make use of your stand-up desk, whether you have it right there in your table or you make your low-tech stand-up desk, from your wall. Get a piece of wood and install it. So working from home is a blessing, because then you can also go and stretch out for a little bit. Give yourself 5 to 10 minutes of a break. Go grab some water, go to the bathroom, and then you can do some of those stretches and or exercises that your doctor or whoever is your healthcare provider is giving you in order to do endurance exercises and or stretches. So working from home, it's not a bad thing. It's actually pretty good. I believe it's good for function, structure, maintaining your good habits of stretches and endurance exercises, and as a result, you can maintain good posture too. Another question that I get under that category is, "Hey doc, I work. I go to a coffee shop and I get up my laptop there, and what should I do? Am I hurting my neck, my back, or whatever?" Again, ergonomically correct positions for laptops, because usually what you take to coffee shop as your laptop, will be that your neck is never, or your eyes are never, to be any lower than where the top of your screen is. So that means that you may have one of these contraptions that you put your laptop in there and elevates the screen to your eye level. That way you have 30 degrees of sweep from top to bottom on your screen. So if you are fixated on a laptop that is on that table in front of you, you're looking down. You're contributing to your tech neck. You're flexing your head for extended period of time. Besides that, in 5 to 10 minutes, your head's going to be approaching that screen, making it even worse. I mentioned before the bowling ball weight. I like you to try this. Grab something, let's say a bowling ball or something, a mass that weighs 12, 14, 16 pounds, and put it up against your chest. See how long you can hold it there. You probably can hold it there for a long time. But bring it out 6 inches, 8 inches, 12 inches outside of your chest and hold it there. That will be the equivalent of your head being held by the muscles. Your arms will be the muscles in your neck. you're holding it there for an extended period of time, you're going to get tired. Well, those muscles in your neck are exactly the same. They act the same way. So when you're sitting in a coffee shop and you're bending your head forward to meet your screen, it's basically hurting your neck. It's giving you tech neck. If you do this often for extended periods of time, definitely eventually you're going to end up having some signs and symptoms, which you need to be checking, getting checked out, because they don't go away, they get worse. So coffee shops are great. You can be drinking your favorite coffee, but make sure that you have that laptop at the right position. And I wish you could see how I have it set up right now, because I have a laptop, and right now my eyes are right in line with the top of my screen, and then my eyes can look down up and down without having to bring my head down. Now, not only that, straight, but sometimes, I don't know, people have other things. They put their telephone on the side, and their screen on the laptop, it's slightly towards the right or the left. That also brings an extra stress. If you have your head rotated to one side or the other side for an extended period of time, and your laptop is down on top of that table without meeting, that height that I was recommending, now you're adding another vector to that position, meaning your head is going to be held forward after a few minutes, and those muscles to whatever side you're turning. On that side, you're going to have those muscles shorten because they're actually turning your head that way. And now you put them over a period of time on that position, you're going to make them weak. They're going to get tired. You're going to get neck aches. So be careful with your coffee shop jobs or works with your computer. Moving right along in our podcast, there's certain other areas that I like to touch. Family health, okay? A lot of people ask, like, my teenager has a heavy backpack. Could that cause long-term damage? All right, I've seen before, when I was going to school, we carry books, and those books were really heavy. So you put them in your backpack, and we will have the backpack right, at the top of our back. The recommendation for heavy books or anything that you're carrying, because you're not only carrying books, you can be carrying computers and all that, and they're adding weight to your back. The answer to that is yes. If we don't have them carry those books in the backpacks in the right position or the right way, it can cause problems in the future. Because we get kids in school here with backpacks since they're first, second, third grade, all the way out to college. So that can be 20 some years of carrying books in your backpack. So what we recommend is this: lower that backpack, whatever it is that the load that you put in those inside. Make use of the straps. Those straps, you can elongate them, and the position that will give you the least amount of stress is the position that, with that weight, keeps you walking straight, not bending forward. So, for instance, sometimes the amount of weight could make you balance, distributing that weight and keeping you walking straight, keeping your child walking straight, if it is right by their lower back. In other words, the bottom portion of that backpack, it's right by the lower back, or whatever low or height you need in order to keep that balance of an erect spinal column. So whenever it is too much that you have to bend forward, he or she has to bend forward, that weight needs to be redistributed by lowering the center of gravity from that backpack. So in other words, use those straps, allow that backpack to hang back on child's back, and see what area it's that balanced accomplished, where it's comfortable. The weight of that backpack versus the weight of keeping straight is equalized. Don't ever allow them to go either. Obviously, no one's going to walk back like, extending their back, but you see them trying to get that weight by bending forward. So balance that weight by making sure that the straight position is equal to the weight of the back. So use the straps to lower that backpack on them. So what quick tips can you give me, Doc, in order to accomplish certain things? Like what's a good stretch that everyone should do daily? Well, the word everyone is obviously, relative, because not everyone can do all the stretches. But bringing in most people for stretches, you want to make sure that you're stretching your neck muscles, your shoulder muscles, your low back muscles on a daily basis. And that has to be done in a mild fashion. You don't have to go to the gym in order to do that. For instance, low back, depending on what kind of work you do, you want to make sure that your low back muscles are stretched out before you start your day and after you end your day of, let's say, sitting down at a desk and also commute. Those same muscles that you are recruiting in order to stabilize your low back vertebrae are going to be active the whole day. So you want to stretch them before, and then you also want to stretch them after the activity. Before would be in the morning. After you came back home from your commute and work, you want to stretch them out. I'm talking about core muscles, that iliopsoas muscles. The iliopsoas muscles are very, very important. Also, the abdominal muscles give you support, anterior support in the low back, but for your low back. But you want to make sure that those core muscles inside your spine, not inside your spine, but inside your body that are along the side of the spine are also stretched out before and after. That's a routine that I recommend, especially as we increase time in desk-related activities, plus our commute. If you're lucky not to have to commute and you're at home, I encourage you also to stretch your muscles for that type of benefit, because you eventually going to be sitting for extended periods of time, and it's basically required that those muscles be strong and not super tight. I've been asked about stretch and balance as a routine, and as we know, the population in the United States is getting older. It's the average now is about 38 years of age. So we're not getting any younger, guys. And here's what we want to do. Including exercises and stretches that require also balance. Those are more exercises than stretches. But if you're standing and you bring yourself onto one leg only, let's say, and then you bring your arms out to the side, if you're looking straight up with your eyes open, you got pretty good balance, relatively speaking, unless you have balance problems that could be associated with other conditions, and hopefully by that time you have been diagnosed if there is a balance problem and things are being done for that. Let's say you don't have any of those conditions, but you're trying to do balance exercises. The proof comes when you close your eyes, and that involves actually brain activity, parts of your central nervous system that actually give you the stability while your eyes are closed. Some things alter those abilities, and that's why police officers use this type of not exercises but tests to see what your balance is, because alcohol can alter that. But that's a completely different subject. Without any central nervous system depressants, CNS depressants like alcohol and such, if you close your eyes and you're trying to keep balance exercises and you notice that you start getting a little wobbly, then we know that there's something affecting that. Could be many, many things, but among them is age. You start aging. The aging process may keep us from maintaining our balance. What I recommend is try them anyway, but be safe and either have something to hold on to next to a wall or something in order to avoid any falls or anything like that, losing your balance and hurting yourself. But the more you try to do balance exercises, the better, because it actually improves, makes your brain adapt to it. So there's some gadgets that I recommend to my patients, but I'm not gonna let them all out here because again, people go, oh yeah, Dr. Boris said I should get this. No, there's certain things that wobble boards and balance boards and things like that you can use in order to get the benefit of balance exercises and restore that ability to keep balance. But as we age, we want to also include our balance for our health. Okay, so there's a couple questions I want to ask you. So why don't you drop a comment with your biggest pain point? I'll address it in next episodes or whenever we get them. And another one is tag someone who needs to hear this. Share the story that we just talked about. And then, what's your biggest health challenge living in Southern California? Let me know below. So part of our new format and on the podcast, I'm putting together the information that we give out, and beyond that, information that sometimes is not discussed in the podcast. So it's going to be 100 pages, and it's going to be loaded with information that you've always wanted to know but were too afraid to ask. A little joke there. So it's going to be 100 pages, and it's going to be completely free if you sign up for our newsletter. This is going to be made available exclusively for our podcast audience. All right, so if you want to hit me up with a coffee, and for Crizza's too, because she loves coffee, you can connect with us with Venmo and PayPal. Just to make the legal department guys happy, again, remember, I'm a chiropractor, but I'm not your chiropractor. And anything that we discuss here is for information only. So I'm not diagnosing, treating, or recommending anything, only giving you info. So make sure that you address any issues with your healthcare provider. All right, now, so if you want to have a 30 minutes complimentary consult, one lucky audience, podcast audience member will get one consult with me for about 30 minutes via Skype or Zoom if you join our newsletter. So only for our U.S. followers, I'm thinking about giving the opportunity for everyone in the U.S. To have a consultation with me over Zoom and Skype. Obviously, that will be a paid consult. We're going to be making that available. Thank you for listening to our podcast. We have lots more information coming, and hopefully the lovely Crizza will be joining us soon. And be aware that it's coming. Ask Dr. Boris. We're here to help. We love our audience. Stay well.
Thanks for listening to today's podcast. Please like and subscribe and follow us on Instagram and YouTube at Ask Dr. Boris TV.